Welcome to We Are Valley, a podcast by Valley Medical Center, located in Renton, Washington. We Are Valley is dedicated to providing you bite-sized advice to improve your health and well-being, and keep you updated on the latest medical guidance. This podcast is for informational purposes only and is not intended to be taken as medical advice. So please talk to your provider before making changes that will affect your health.
Hi, everyone. This is Alex McGuire. I am one of your producers of the We Are Valley podcast and your host for today's episode. I am really excited today to be joined by Dr. Marwaha, who is the director of cardiology here at Valley. We are going to be talking about metabolic syndrome. Dr. Marwaha, thank you so much for joining us. Welcome to the podcast.
Thank you. Thank you for having me.
Just to start, can you tell us a little bit about yourself and your career and what brought you to cardiology?
So, I'm actually from here. I grew up in Bothell, and then went away for school and training and stuff. And then came back here about 10 years ago because it's close to home. It's a great program. And then as far as cardiology, it was, sort of interesting. When I was in training, I wasn't exactly sure which way I was going to go. And then by sort of happenstance, I was on a cardiology rotation and really liked it. I like the fact that it's sort of inpatient, outpatient, kind of see most people in the hospital, so you interact with a lot of other specialties. And there's still a lot of general medicine involved in cardiology. So it's kind of like a mix of everything, which I really enjoyed. So that's where I ended up.
Thank you so much for sharing a little bit about that. We're here today to talk about metabolic syndrome. Sometimes you can see that also written as MET, capital S, or METS. Let's start it from the beginning. What is metabolic syndrome?
So it's actually been described for about 100 years or so. It used to be called Syndrome X. It's a combination of having what they call central adiposity, basically being heavy, specifically carrying fat in your midsection or torso primarily, as well as having elevation in your blood glucose, so not quite diabetes, kind of pre-diabetes, I suppose, blood pressure issues, and cholesterol issues. So a combination thereof. There's different definitions. I think different societies have slightly different definitions of it. So, depending on which definition you use, you may or may not fall into it. But I think the general consensus is a combination of these four factors. And you don't necessarily need to have all of them to be classified, but that's traditionally how it's done. The theory behind it is that those combination of factors make you more prone for cardiovascular disease, diabetes, and there's also associations with like liver disease and renal disease. But the primary concern is heart attacks and cardiovascular events.
Thank you for that. It's interesting, like you mentioned, that it is this recognized and identified cluster of symptoms or cluster of health factors, maybe not necessarily like across the board consensus, but, some trends that we have seen that lead us to want to monitor it. How common is metabolic syndrome?
So I was actually looking this up last night. So it's actually fairly common. You think worldwide about 25% of the population has it. And in America, it's probably closer to a third of people can be classified as metabolic syndrome. It does have some racial socioeconomic disparities. So Hispanic populations seem to have a higher rate. And I think Asians generally are a little bit lower, but they're all high. It's all degrees, right? Like everybody's at a relatively high rate. It's not like there's a population that's at 1% or anything like that.
Right. Yeah.
So, there's, some subtleties in population and socioeconomic status, but overall, it's actually fairly common. And the rate has actually been increasing, I believe, over the past 20, 30 years. Yeah.
Definitely something to be aware of then.
Mm-hmm. Yeah.
We talked about this a little bit, but could you kind of run down the risk factors that are associated very specifically with metabolic syndrome?
Sure.
Again?
So the main risk would be, let's just start with the easy one, which is weight, right? You could go by like BMI. I think specifically for metabolic syndrome, it's waist circumference. So not only being heavy, but actually having, like I said, carrying most of your weight in your midsection or torso. And I believe there's different definitions. I believe for men, it's 40 inches waist circumference, and women, it's 35 inches. I think there's some variations. Some societies have different guidelines. And there's also, like I said, since there's racial and socioeconomic factors, there's some racial guidelines as far as like subtle differences. But basically, if you're carrying a lot of weight and you're heavy and it's in your midsection, whether your waist is, let's say, 38 and you're like, oh, the guideline's 40, you're still at risk, right? It's a spectrum. So there's not really a cutoff like, oh, well, this guideline says 37, so I'm at 36.5, I'm good. It's not quite that way. So that's number one. And the second one would be, let's go with fasting blood sugars.
Mm-hmm.
So So they categorize it as sort of like pre-diabetes, right? So you have an elevated fasting blood sugar, but not quite enough to diagnose you with diabetes. So that's number two. There are some guidelines that said if you have a history of diabetes, then that also counts. But then other people have said, well, since this is supposed to be a risk factor for diabetes, having diabetes sort of negates, having it.
Yeah.
But again, it's also a spectrum, right? It's like, well, if you're on the road to diabetes or you have it, it's something to be aware of regardless. Elevated blood sugar, diabetes, or pre-diabetes, it's another risk factor. The third one would be cholesterol. So this is a little bit tricky. So there's a couple of components to it. So one would be having a low HDL, which is your good cholesterol. And the second component is a high triglyceride level, which is your fats in your blood. So interestingly, like having a high LDL, which is your bad cholesterol, is not considered part of the syndrome, although it can be additive. So if you have a high triglyceride level, you typically have a high LDL level too. Not always, but they kind of go together. So usually you have to treat multiple things. But technically, I suppose some people can fall into having a okay LDL, which is your bad cholesterol, and having low HDL, which is your good cholesterol, and that also categorizes you as one of the risk factors for metabolic syndrome. And but the easiest way to think of it is just abnormal cholesterol. Let's just keep it simple. And then the last section is blood pressure. So basically, a resting blood pressure greater than, let's say, 130 over 70, which is more or less the cutoff. Again, you can argue a few points up and down depending on the society, but if your blood pressure's high, that's another risk factor. So those are sort of the four. And then they're not official risk factors, but things that contribute would be sedentary lifestyle, right? So if you don't get a lot of exercise and stuff, that just sort of makes this sort of stuff worse.
Kind of an aggravating factor.
Correct. Yeah.
Because we might be introducing concepts that people aren't familiar with, can you talk a little bit more and expand on what we mean when we say a fasting blood sugar?
Sure. So basically, when you get your blood drawn, when you come in fasting, your blood sugar should be within a normal range, which would be typically under 100. So if you're over 100, but less than 126, which is sort of like the guideline for official diabetes, one of them. So let's say you're at 105 or something like that. You're sort of in the risk of prediabetes. Now, there's always certain things that you should keep in mind. So one is that it's hard to make a diagnosis off of one test. Right. So if you have one, and it's like a little bit high, I usually recheck it and just make sure that it's truly there, because you could always have like a bad, fatty meal or a sugary meal, like that's why it's high. Some societies recommend doing what's called a glucose tolerance test, which is more advanced, but basically you consume sugar and we check your blood. Yeah, essentially that's sort of the general guideline of it, to see how well your body like metabolizes the sugar and, to see if you truly have what's called insulin resistance. So, if you're not processing sugar appropriately, that would be the key risk factor. Either way is an acceptable way to sort of confirm the diagnosis.
Gotcha. Thank you for that expansion.
Yeah.
I really appreciate it. Okay, let's move on to the next question that we outlined, which was why is metabolic syndrome considered a significant risk factor for cardiovascular disease, type 2 diabetes, and other conditions?
Yeah, good question. So, and I will say there are some studies that would question whether the syndrome itself, if it's truly a quote unquote syndrome, right? Because that would imply that there's something specific about that combination that makes it, even worse for your heart or anything else. There are some people who say, well, these are all risk factors for heart disease. So it sort of makes sense that they kind of go together. And then the question is, if you have all of them together in aggregate, is your risk higher or significantly higher than each individual one if you add them up? And yeah, I think the data would suggest that there probably is some truth to it, particularly if you're older. Having all these when you're over 60, 65, there probably is a higher risk. And I don't know that anybody really knows like a concrete theory as to why it is. Like, it's hard to say, but my guess is that there's a combination of all these risk factors put more stress on your organs, can cause inflammation, and they sort of play off each other to worse, and you get in this sort of like vicious cycle of like cholesterol's high, your blood pressure's high, your blood glucose is high, you're insulin resistant, you got fat around your organs, especially centrally, which that's not great for your organs to have a lot of fat around them. That puts more stress and inflammation around them. And it's that combination of things that sort of accelerate the problem. I think the main concern is cardiovascular disease, right? So heart attacks, strokes, works. It definitely puts you at more risk for diabetes, but like I said, these are also risk factors in general for diabetes. And so some authors have said, maybe the syndrome itself doesn't necessarily increase your risk other than just having these risk factors. But regardless, I think it's sort of like where they say like a distinction without a difference, right? Like you still need to take care of it,
Right.
whether it's causing all these things. But this combination definitely makes the risk higher, right? So
it sounds kind of when we have multiple systems within our body stressed, it can lead to just overall stress on the system tends to sometimes manifest additional risk.
Sure, absolutely.
Can you talk about how is metabolic syndrome diagnosed?
So the diagnosis is usually you can get at your primary care doctor or any of your specialists. Yeah, it's just like I said, blood pressure, cholesterol, blood sugars, and then checking a weight. A lot of places they don't necessarily measure your waist circumference as a routine thing, but anybody certainly can. But even having the other diagnoses, those are usually part of most standard primary care visits. They usually take your blood pressure, and at some point they will have checked your cholesterol and your blood sugars. It may not be that visit, but it may have been something relatively recent. You can start putting things together and figuring out what's going on. But you can also look at your own chart. If you say, okay, your blood pressure is high and your cholesterol is showing red on your lab test, and your blood sugar or glucose is showing red on your lab test, then you can kind of figure out yourself and be like, oh, okay, this is some sort of risk, and you certainly can ask your doctor about it if they haven't brought it up before. That's typically how it's diagnosed.
So what I'm hearing is that regardless of getting a formal diagnosis, it is something that maybe sometimes people can recognize as that cluster of risk factors that maybe that needs a little bit more attention.
Yeah, absolutely. And I don't necessarily, I have a lot of patients who have similar findings, right? They have all the things. I don't necessarily diagnose them with in their chart, you have metabolic syndrome, because, there's not really a particular treatment for it other than treating the underlying conditions. So I suppose I could, but it doesn't really change, what we should do. But yeah, if anybody's concerned, it can certainly, look through their charts and see what's going on. Yeah. Absolutely.
So that's actually a really great lead into our next question, which is metabolic syndrome permanent? What kind of lifestyle changes can be rolled into a patient's care plan to help prevent or even reverse metabolic syndrome?
Sure. Absolutely. Yeah, it absolutely should not be permanent, right? I mean, I would put it a little bit of a caveat. So I would say some of the medical issues that you have, like blood pressure, cholesterol and stuff, they can be treated and managed. It's hard to get rid of it permanently without medications, but it's possible. So, let's see. But especially if you're younger, it's definitely doable. And no matter what your age, and certainly worthwhile to get treated. This first step is always diet and exercise, right? As much activity as possible, but even if you can't, I think they recommend at least 30-minute sessions, 3 to 5 times a week. If you can do more, that's great, because that's sort of the basic, right? If you can do it every day, that's great. Go longer. As far as how intense, moderate, I know people like numbers, but it's enough to where you feel like you get a good workout. Maybe you're sweating a little bit, or you're definitely working out and feeling it, but not so much that you're overdoing it, right? It's not a great specific guideline, but something. And especially if you haven't been exercising and you're going to start, I would definitely start slow and work your way up. Walking is great. Start with that. You don't necessarily have to go to a gym, and walking is excellent to start with and see how you do. So that would be number one. Number two is diet. I usually tell my patients there's a lot of diets out there. It doesn't really matter which one, as long as you have fruits and vegetables, low salt. And if you want to keep a simple one, just go with a low salt diet. Doesn't matter what one. Salt is usually in a lot of things that will be bad for you. If you just sort of try to stick to a low salt diet, you'll sort of naturally gravitate towards, more fresh fruits and vegetables, less processed foods, less trans fats and fried foods. Doesn't mean you can never have a hamburger once in a while. I usually tell people you have to completely avoid it, because that usually turns people off. But for the most part, you should have fruits and vegetables, lean meats, and once a month or something if you want a fried steak or whatever. If that's what it takes, that's fine. I'd rather you avoid it all, but if you just limit it and 90% of the time you're doing good, that would be very helpful, right? And it doesn't have to be perfect. I think people get hung up on that too. I had 2,500 milligrams of salt instead of 23 or 2,000 or whatever guideline they have, or I had a little bit too much of this or that. It's not a hard and fast thing. It's a guideline, So if you go a little bit higher one day, that's all right. Just the next day, just go back to normal. You don't have to like overcorrect or do anything. Just like, once in a while, if it goes over, that's all right. You just do your best, right? So those are the best things about it.
Giving yourself a little bit of grace, right?
Yeah, exactly.
We're not machines. We're not perfect. Sometimes we're going to have cravings. But knowing that we're being mindful around the things that we should be, right?
And it's a lifestyle change, right? So it's like you should do it, every day. You should try to incorporate it into your daily routine. So walk at lunch, walk at night, walk in the morning, whatever, but incorporate it where you can, right?
Mm-hmm.
Walk in the mall,
Great tip.
So yeah, exactly. And same thing with the food, snacks and sweets around because it's the holidays. Okay, I get that, but that's not going to be an everyday kind of thing. So for the most part, you should be like trying to adjust your diet. And through that, over time, that should definitely help, right? If people want to avoid medications, not that I can guarantee that you will avoid it, but if you're going to have a chance to avoid it, that's the way to go. Diet and exercise is the first step. And some people, it's genetic that you do your best and it's still not making it. That's just the way it is. And a lot of people actually will probably need help in at least one of those risk factors, if not multiple risk factors. But maybe you don't need as much medication if you do the diet and exercise. Maybe you don't need any. Maybe you still need some. But that's step number one.
And that's kind of, I think, where we get into that's why you have a specialist, right? That is why you have a care team to help you work through what's going to be right for your specific care.
Right.
You mentioned medication and how that, depending on circumstances, can help people get to where they need to. What kind of medications play a role in managing metabolic syndrome?
Sure. The simplest one would be, let's say, with blood sugars. The standard is to start metformin, which has been around forever, relatively well tolerated. So that would be the starting point. There are other medications for blood sugars. And like I said, if you do diet and exercise, you may not need it. It may come down just with that. But if you were to need to start something, that's usually the standard thing to start. There are some newer medications. Ozempic is famous. But, there are some other ones too that, would probably give the same result, right? So those are options as well. Cholesterol, statins, like a lot of people don't like statins for whatever reason, but that for the vast majority of people, they're fine. There are some people who they can't tolerate it. That's fine. I would say give it a try. And if you're not tolerating it, then we'll try something else. But I would say for, the vast majority of people, they should be okay with a statin if you need it. If your cholesterol is not coming down with diet and exercise, that's the next step. The only caveat to that is that for triglycerides, which are the fats in your blood, those are typically treated. Statins can help a little bit, but they are a different medication called fibrates, which is slightly different. It's possible you might need both, depending on how bad things are. But those are the sort of the standard medications. There's a lot of new things for cholesterol. Those are injectables. And typically we don't start with those. We usually try the simple stuff first, which is pills and diet and exercise. But if that's not doing it, there are alternatives now that have come out in the past couple of years that we didn't have before, so there are definitely more options for that. And then the last one would be blood pressure, of which there are a variety of medications for. And again, diet and exercise can bring down your blood pressure, but there's, 20 different things that we can use for blood pressure. Some of it does depend, if you do have blood sugars and high blood pressure, there are some medications that are better than others, which you discuss with your doctor. Yeah.
That's great. We love options that help.
Right. Absolutely. Yeah.
Float all boats. You had mentioned it a little bit kind of in us bridging the topics between, lifestyle changes that can be used to manage, but as well as in combination with medication. Are there circumstances where we would immediately start someone on medication before trying lifestyle changes? Or is lifestyle really where we start before we would ever look at medication?
No, that's a good question. Actually, it depends on how bad things are. So if you were otherwise healthy and this is sort of found during a routine physical, at your primary care or whatever, I think you could probably start with, lifestyle medications and check in 3 to 6 months and see how you're doing, right? If you're seeing me, you probably have gone through your primary care doctor already. So people who are seeing me or one of my cohorts, you're a little sicker. You don't get to me without having some issues going on. I usually start with some medication, at least one, if not several, just to get things going. And we can do diet and exercise. And if you get better with diet and exercise and your numbers really come down, then we can cut it back later. But, once you're seeing someone like me, who's a specialist, you're probably having some cardiac issues or vascular issues, or they've seen blockage build up. As people get like CT scans or something, and they're like, wow, you have a lot of calcium and atherosclerosis build up in your vessels. You come see me. But yeah, and me personally, I usually say once we know there's a problem, like let's just be as aggressive as possible. There's nothing wrong with like, hey, let's just get your blood pressure down, let's get your cholesterol down, make sure your sugars are okay, and then we can regroup later.
Yeah, which we definitely want to avoid for sure.
Yeah, exactly.
So we're at our last question already. What would be your tips for patients on how they can work together with their healthcare providers to develop and manage an effective plan for metabolic syndrome?
Yeah, I think the key thing is, I think open communication is good. You should sort of understand what is going on with each of the medications, right? I think it's a lot easier to know, okay, I need to take this because this is helping. I think, having a guideline of numbers, I don't like people getting too hung up on those, because then if it's a little high or something one day, don't worry about it, right? It's just sort of like it's a long-term thing. So having
care about the pattern.
Exactly, yeah. So if let's say you have diabetes and for a little while your blood sugar is high, okay, don't panic about it. We'll make some adjustments and get it down. But you don't need to worry about like doubling your medication that day or something like that. If there's a medication that's bothering you and you have some sort of effect, bring it up. And if there's an alternative, we'll try it. Sometimes there are no alternatives, unfortunately. Then we have to decide, is the effect so bad that we have to risk, other things and get you off the medication. But I think that's a conversation that people should have, right? I will say for the vast majority of people, they can tolerate these medications for everything. When you consider that, I think a lot of people who are older, they've had all this buildup and never had medications. We didn't think about diet and exercise in the same way we do now, I feel. And, it had as much of an understanding of how, food and stuff plays a role, fried foods, salt, all this stuff. This is really relatively recent, not like, within the past 20, 30 years, let's say, right? I think a lot of older people probably have some buildup in their arteries, and those would probably be more prone to needing medication. If you're younger, and sadly, there's actually a lot of children who have this syndrome, I think there's more time to diet, exercise, lifestyle change, and avoid the problems down the line. So, if you're 20 or 30, you won't feel the symptoms that come from heart disease or strokes or anything, hopefully for decades, right? But it starts now because if you don't do anything, it'll just keep building up, and you'll see someone like me. And then, by then it's like already built up. The medications don't dissolve them necessarily. It's basically like once you have them, the goal is to manage them so they don't get worse, but they don't necessarily like disappear. So the best thing to do is to not develop in the first place. And, diet and exercise is the best way to go. It's definitely one of those things that you need to keep an open communication with all your providers, right? If you're seeing cardiology, great. A lot of people see GI or nephrology or your primary doctor. There's a lot of people who have multiple providers. Just sort of make sure that everybody's aware and keep contact with them. And if something's bothering you, let them know. There are always potential for adjustment and changes, but I don't know if you don't say anything, right? So
exactly right. So, can't help if I don't know what's going on.
Exactly.
Well, those are all really great tips. Is there anything that we haven't covered or things that you want to go back to and revisit?
One thing I do want to emphasize is that we are seeing a lot of younger people having this syndrome. And even if you don't have all four, let's say you have 2 out of the 4, that's still a significant risk factor, right? Like you should, just because you don't have everything doesn't mean you're like, okay, I'm good. You should really keep track of it. We have seen, 20-year-olds having heart attacks. So it's not unheard of anymore, which it used to be super rare. And I feel like it's getting less rare.
Yeah. Which is scary.
Which is scary. Yeah, absolutely. So, it's always good to keep up on your health. And that would be the main thing, is like age is a factor, but it's not the only factor. And being young doesn't necessarily exclude you from this, and being old doesn't mean we can't, stabilize things. And then the other thing to really think about is that these risk factors, we're talking about cardiovascular disease primarily, but there is a risk factor with kidney disease and, especially like fatty infiltration of the liver, which is really a problem. And is actually one of the major causes of liver disease now is not alcoholism or alcohol use. It's actually fat. So if you start to get fatty infiltration, steatohepatitis, as they say, these are also major risk factors for it. So treatment for metabolic syndrome will also help your liver, potentially help your kidneys. in addition to, stroke and heart attack. So there's other benefits to it beyond just cardiovascular, even though that's kind of what I'm primarily concerned with.
Okay, yeah.
And treating these things does help with those other effects as well. So, getting your blood sugar and your blood pressure under control will help your liver. So those things are also there to consider.
Awesome.
Yeah.
All right. Well, I think that is all we had planned for today, so I will go ahead and wrap us up. Our guest today has been Dr. Marwaha, who is the Director of Cardiology here at Valley Medical Center. Thank you again so much for your time, Dr. Marwaha.
Thanks for having me. Awesome.
All right. And thanks to everyone out there who is listening.
This has been We Are Valley, a podcast produced by Valley Medical Center in Renton, Washington, as a part of our mission to care for our community like family. If you liked this episode, be sure to subscribe to our feed for more great health content. And for more health resources or to find a provider, visit valleymed.org. Thank you for joining us.